Hi everyone, my name is Asli and I am a medical student based in Birmingham in the UK, and I'm deeply passionate about Parkinson's and movement disorders. And over the past few years, I've been very lucky to learn and contribute to this field through multiple research and clinical experiences across the continents. And I'm also the founder and director of Parkinson's Care, which is a global platform dedicated to increasing awareness, but also keeping both patients and clinicians updated on the latest developments in Parkinson's disease. So, I, in terms of my clinical experience, this summer I was at Cedars-Sinai Medical Center in Los Angeles, and I learned all about Parkinson's under the mentorship of Dr. Michele Tagliati, who is a renowned Parkinson's neurologist. I also currently work on research collaborations with the University of Cincinnati's Movement Disorders Lab with Dr. Alberto Espace team and Cedars-Sinai Neurosurgery and University of Birmingham locally. I also volunteer actively with Parkinson's Foundation, Parkinson's UK, Parkinson's and Movement Disorders Alliance, and of course, Parkinson's Australia, where I contribute through articles and awareness work. That's all about me, but today I wanted to talk to you about sleep, and it's something that we don't really talk about until it's not there. It is often overlooked in a clinical scenario, and it is undertreated in clinical practice as well. It is really essential for brain health, and it enables crucial brain restoration processes and clearance of metabolic toxins that accumulate during the daytime. And also, it's connected to well-being. So essentially, a good sleep means that you'll have a good day, and the good quality of sleep determines quality of your day, essentially. And this is more important in people with Parkinson's. But why is sleep really important? I mean, sleep isn't just passive rest. It is when our brain refreshes, resets, stores memories, and clears the brain. So it clears waste products like proteins, like alpha-synuclein that accumulate in Parkinson's, and also it impacts symptoms quite seriously. So, for example, poor sleep quality will directly worsen both motor symptoms and non-motor symptoms found in Parkinson's. So, in order to talk about sleep within Parkinson's, let's talk about what really happened during sleep and understand the mechanics behind it. So, during a normal night, we cycle through different sleep stages, and these stages make up the cycle, which lasts about 90 to 120 minutes, and we cycle through these multiple times throughout the night. So, there's stage one, which is a lighter stage of sleep, and it occurs as a person first falls asleep. There's stage two, where the body starts to relax a bit more deeply, and body temperature drops, muscles relax, and heart and breathing rate also drops. There's stage three, which is the deepest and most restorative part of sleep, which allows the body to recover and grow. And these make the NREM part of sleep, which is non rapid eye movement sleep. And then there's a REM sleep, which is rapid eye movement sleep. This is where all the dreaming occurs. And the brain activity increases, and the body becomes temporarily paralyzed. So the muscles eventually switch off. And the last bit, the muscle switching off, is really important. And in Parkinson's, that switch can sometimes malfunction. But why is this switch off really important? During REM sleep, a specialized mechanism in the brainstem actively inhibits muscle activity, which results in the muscle switching off. And this temporarily paralysis is vital in protective function. The switch off prevents from physically acting out a dreams such as running, fighting, or other vigorous activities. However, when this protective mechanism fails, sleep-related movement disorders can rise. Parkinson's affects parts of the brain that control movement, but also areas that regulate sleep, breathing, and dreaming. So, here are three reasons why sleep can be affected in Parkinson's. So, neurodegenerative changes, such as loss of dopamine producing neurons and accumulation of alpha synuclein protein, which disrupts the brainstem areas responsible for sleep regulation. Medication timing effects. So, Parkinson's medications can sometimes cause things like insomnia, vivid dreams, or nighttime motor symptoms can also just affect sleep. And the interference of the motor symptoms, so nighttime rigidity, tremor, and difficulty turning in bed can fragment sleep. So also increased urination during sleep can result in multiple awakenings, which will eventually affect sleep. Because of these changes, there are two sleep conditions which are especially associated with Parkinson's that I would like to talk to you about today, which is REM sleep behavior disorder and obstructive sleep apnea. These are really highly relevant conditions in Parkinson's, yet they remain significantly under-recognized and undertreated in clinical practice. So first, let's talk about REM sleep behavior disorder, which is RBD for short. So RBD occurs when the normal muscle paralysis of REM sleep fails, and therefore individuals tend to physically act out their dreams, often with violent or vigorous movements. So the common behaviors of RBD patients would be kicking, punching, or grabbing motions, or shouting, talking, acting out vivid dreams, falling out of bed, or striking a bed partner. Now, importantly, individuals tend to not really realize that they are doing these, so observations from bed partners or family members are crucial for diagnosis and safety planning. Now, why is RBD really important in Parkinson's anyway? I mean, it is an early warning sign according to multiple research papers. RBD can appear 5 to 15 years before motor symptoms of Parkinson's develop, and it eventually serves as a potential early biomarker. And there's a strong association. There was this one research paper that I read where over 80% of individuals with isolated RBD will eventually develop Parkinson's or related conditions like Lewy body dementia or multiple system atrophy. So RBD is not just a sleep issue. It can act as an early window into brain health. It is essentially a window into neurodegeneration so that we can potentially develop neuroprotective interventions. And it is something that requires clinical action. So it requires comprehensive neurological evaluation, sleep studies, which the scientific term would be polysomnography confirmation, and implementation of bedroom safety measures. So what can you do for RBD? Essentially, safety at home is the priority, so removing sharp objects around the bed, or adding panning or cushions around the bed in case the patient was to fall, or in severe cases, considering separate sleeping temporarily if there's a risk of injury. In terms of treatment, it is very personalized for every patient, and a whole neurological assessment is essential. But usually, the first line treatment is melatonin or clonazepam, according to a few research papers. That's all about RBD. Let's talk a bit about sleep apnea. Now, what is sleep apnea? It is essentially repeated episodes of where breathing stops and starts during sleep due to temporary collapse of the upper airway. This condition is increasingly recognized as relevant to Parkinson's and Parkinson's disease risk and progression. So common signs of sleep apnea, the textbook signs would be loud snoring with gasping or choking sounds, pauses in breathing during sleep, unrefreshed sleep despite having a full night's of sleep, or excessive daytime fatigue. So there was this research paper that I read recently which showed that obstructive sleep apnea is more common in people who later develop Parkinson's disease. So there was a very large study where they followed over 11 million US veterans, and they found that sleep apnea had a significantly higher risk of being diagnosed with Parkinson's several years later, and even after adjusting for age, weight, comorbidities, and other confounding factors. And crucially, this is a real game changer. The study also found that people who started the treatments for sleep apnea, which we call CPAP, if you were to start the treatment early, within about 2 years of their diagnosis, they had a much lower risk of developing Parkinson's compared to those who had sleep apnea, which was remaining, compared to those who had sleep apnea, which was left untreated. Now, that doesn't mean that everyone with sleep apnea will get Parkinson's, but it does suggest that sleep apnea might be more than a sleep problem. It could be a modifiable risk factor for brain health. And prioritizing and treating sleep disorders early may not only improve quality of life now, but also help protect the brain long term. So a bit about sleep apnea. The key landmark symptoms are snoring loudly or waking up tired or daytime fatigue, which then you would request a sleep study from your doctor and your neurologist. And this sleep study is essentially non-invasive. They essentially grab data from your sleep, and this would be analyzed by a sleep doctor and your neurologist. And early treatments in this case will improve quality of life and sleep safety for everyone. Now, I know we talked a lot about sleep, but what can we actually do to improve sleep? So things like daytime activity, so staying physically active during the day is essential. And the brain loves consistency and routine. So keeping a consistent sleep and wake schedule, keeping an alarm as to when you should fall asleep, but also when you should wake up, and discussing medication timings with your neurologist, telling them whether your Parkinson's medication is affecting your sleep or not is really important. You can have evening rituals like reducing screen time before bed, or gentle relaxation rituals like having your favorite cup of tea or reading a book before you fall asleep. And also, your sleeping environment is really important for a good night of sleep. So, having a cool, quiet, comfortable bedroom is essential for a good night of sleep. Now, sleep is brain's medicine, and quality of sleep is not a luxury. It is a fundamental pillar of brain health, restoration, and optimal neurological function. And early attention is really important. Recognizing and addressing sleep changes early improves safety and quality of life and overall disease management of Parkinson's. Understanding sleep disorders empowers patients, families, and clinicians to provide more comprehensive Parkinson's care for everyone. Thank you so much for your time and attention, and I am deeply honored to learn and grow alongside this incredible community of clinicians, researchers, patients, and care partners who are all dedicated to advancing Parkinson's care. So thank you.